All right, guys. So I'm back. I took a
Uh,
ketamine treatment, and I'm not gonna lie, it was wild. So, doc, man, it's different. So,
yeah, that's a it's a typical response. So what we did typical at the clinic, an intravenous administration of ketamine, just like you would get, say, in the hospital or clinic, like we did. But it's pretty standard. We used a certain dose based on Chris's body weight. I gave it at a certain rate. I monitored him the whole time. He did very well with it, actually. But that first response of like, oh my gosh, it was almost too deep, and you mentioned like, oh, I didn't know if I was going to come back from it. And that's a common response, especially when it's the first time you've, in a sense, left your mind. So that's, but again, the I prepared him well for it, so when he got to that point, he knew he was safe. And it highlights you got to have a medical professional helping you with this. Doing it willy nilly is just so important. So, and we'll get to more, but
do not buy this on the black market and try it yourself.
yeah,
I'll tell you what. Like, if Doc wasn't there, like when you first gave it to me, I was like, it feels kind of like because I've taken recreational mushrooms and kind of opened my mind a little bit. Holy crap! It was so much. It was
yeah,
so intense. I literally lost myself. I
mm,
100%. I just like
um,
I was sitting in the chair and you were right there, but I was not there. I
that's
left
called
into
ego dissolution. It dissolves your ego or who you are, in a sense, or the importance of who you are is lost. And basically it just puts you in a place where you're looking at your whole mindset and everything from another perspective. So it's but a quick thing, and never do this on the street or buy it illicitly. It's there are two different things. And actually I read some of the comments. uh, Pharmaceutical grade ketamine given in a clinic or hospital is nothing to do with the ketamine you buy on a street or in a pill or troche or something like that. They're two different things. And the stuff you get on the street, don't play with it. It's nowadays it's often laced with fentanyl, and there's been deaths because of it. And the DEA is actually seeing more and more illicit use. So I can't stress enough: do it the right way, and you should have a good experience if everything is done well. But we're going to get to that too.
yeah. And so with my experience, I left, came back, and it took me a while to kind of regain my bearings and figure out.
Yeah.
And once I gathered all that, and then you had said, like I said, I had a doctor guiding me, so he's like, listen, right now your brain's super plastic or
Mm.
neuroplast, but you need to now is when you get to reprogram it. Kind of like I did TMS therapy a while ago, and that was kind of the same thing. You can open it up, but if you don't retrain it the right way, you're going to fall right back in the same pattern, right?
Yep. And that's where, so, so given that, part of the reason people get so scared is because you lose time. When you're not on those kind of substances or drugs, you have a sense of time. It never goes away. But when you take any kind of psychedelic, that's the definition of a psychedelic. You kind of lose, there is no notion of time. And it's a hard thing for people to grasp, and it catches them by surprise often. So, uh, in regard to the effects, the positive effects, is like one reason it helps you get out of depression or other mental illnesses, at the worst, suicide, is because it changes that default mode network. And that's just the rut that you always find yourself going back to. And most depressed people just say, I tried to get out of it, but I kept going right back to the things that make me depressed. And the result is depression. Now, after these treatments and proper therapy, I think Chris is going to have a better chance of changing some basic patterns of his brain, and therefore working the neuroplasticity of his brain, and hopefully he's going to benefit from that. This is the whole idea.
Yeah, and it was really, like I said, the thing about time, it felt like it could have been a week. Like it
Yeah.
didn't.
Yeah.
I honestly, I'm like, I looked at my watch when we were done. I'm like,
That was like 40 minutes.
I felt like I'd gone through like a week-month journey and just explored things, and was weird because I felt like there was this energy, but then there was something like over me, and I kept trying to figure it out, but I was in there, but then I kept having, that's when the fear would set in.
Yeah.
And I'd go, okay, just let it go. You'll be fine. You'll be fine. And like I said, had I not been prepared for that, I think this could have been a terrifying event. So,
and a lot of people, like in some of the comments, it is a terrifying event. You know, I like to say there is no such thing as a bad experience, because the terror you experienced is there for a reason. You know, when you go under these psychedelic experiences for mental illness, or any kind of mental purpose, you're facing your traumas, but in a safer way. That, you know, things can get brought up, but you feel okay to look at them face head on. And it's true. If you got some traumas, you know, you need to be prepared. It might be a dark place you're taken to. And that's why we do a series of treatments. Usually, you know, for example, I had a young suicidal 17-year-old. He, you know, came in the first treatment. Yeah, it was literally terrifying for him in a way, but you know, it stopped his suicidal tendencies right there and then. And then the next treatment was much more pleasant. He was in a better place. He saw different colors. He saw, you know, just different, you know, people and things like this. But it wasn't. It was totally two different experiences. So, you know, so that's how you got to. That's why you got to kind of think about it, and that's why therapy is so important. Once you get there, you know, have somebody talk to you, whether you're doing like Chris, listening to a psychologist like Jordan Peterson, or, you know, or there's other like Dr. Phil, or, you know, there's other psychologists out there, just whoever you listen to, or get some real help and talk to somebody. And then, you know, don't forget, reach out to your family. You know, family is huge. So
yeah, and it was weird. I did feel foggy yesterday. Is that normal?
Yeah. You don't quite feel as sharp as yourself the day after. You know, and that's something to consider when you're riding or doing sports. You know, I've done this on plenty of athletes, and then if you read in my book, you know, I cover many NFL, hockey league, MMA. You know, and as I mean, it's public knowledge. Adam Cincerello did an ayahuasca treatment. You do not want to go out and like carve lines the day after. You want to give it like probably 72 hours before you'd ever get back on a bike, kind of thing. You know, you might be able to drive a car or something like that, but you know, it's just it's something you would not. I would not go moto the day after and, like, you know, hit some 100-foot tabletops and all that kind of stuff. I'd give it a couple days, you know, and then you're good. So, yeah.
I ran out of coffee the next morning, so I went to Smith's right down here.
Yeah.
I drove past this gated entrance twice. I'm like,
yeah.
I don't know if it was because I was so deep in my own thoughts, or I was foggy, or a little combination of both. But I'm like, yeah, definitely not a day to go riding.
No, I'd say a combination of both. You know, a lot of people are just so caught up in the moment and their thoughts and just reflecting on everything. Yeah, things tend to go past you, and you know, and that's actually probably it's a good thing from a psychotherapy point of view.
Yeah, and I kept thinking about it, and the one thing it was funny. I'm glad. So he had me listen to Jordan Peterson. I don't know if you guys listened to him. I think he's amazing, and he's got some really great opinions on life and psychology and how to deal with things. And it was something that I tend to do, and I didn't recognize this. I listen to podcasts all day long, every day, and in my free time, I'm always trying to better myself. Andy Frisella, which he goes a little negative these times sometimes, but I listen to anything I can to try and learn. But I felt like after this treatment, man, it just had this different effect. Like I listened to it, and I could piece it together and how it affected me directly. So a lot of times what I do is I try to, today I'm doing one thing, and then I want to be at the end goal the next day. Mm-hmm. And Jordan Peterson kept saying, no, you just have to be a little bit better than the day before and take that win, and then exponentially it will grow. And as stupid as that sounds, it didn't register until after this. And I'm
Yeah.
like, wow. And like, I've had some stuff.
Yeah.
I was telling him just a little bit ago, like, I've had some stressful moments the last couple of days, jobs, girls, types, just stuff that normally we deal with, where normally it would have probably sent me into a bit of a spiral. I'd have probably been really pissed off, but I was able to stop, take a look, analyze it, and say, okay, it's not perfect, but I can fix this. I can go a little bit better, and that's all I need for today. Just a
Yeah.
little bit better than I was before. But it was crazy how that cloud of negativity and the hopelessness that creeps in, especially when you get depressed. When you get depressed, for me, I feel like as soon as I have something negative, you get this desire to like quit.
Mm.
And that's where you think, well, man, it'd just be easier if I was gone. But this, for whatever, I don't know why, I didn't have that at all. I didn't have that.
Well,
It's not.
that's exactly why it stops suicide. You hit it on the head right there. Suicide, the ingredients you need for suicide is isolation, you need to be vulnerable, and you need to have hopelessness. And once you reach those three things in an environment of intense vulnerability, that's when you're most at risk for suicide. And any of these, any psychedelic treatment, I keep going back to, you could do any psychedelic pretty much, but the best studies, are on ketamine and such, and it's the easiest to obtain. You can't come out of a ketamine treatment without having some change in your hope, and that's the main takeaway from that. Negative or positive experience, your hope will be changed. And that's one of the most powerful effects of doing this whole thing. So it's awesome.
Well,
That
yeah,
is so cool.
it
Good
gave
for you.
me like this perspective
Yeah.
to where your problems are your problems.
Mm.
But after being the week I spent
Mm.
with you on the couch, which was actually an hour, things just didn't feel as big. They just didn't feel quite as big. And while they're still there, there's still the problems. There's still got to work. I still got to do this. I still got to do that. Um, I didn't feel like I didn't fall into that depression cloud.
Mm-hmm.
I think that's something. I don't think it's something it's not a magic pill. I don't think everything's fixed. I don't think I can just let it go.
Yeah.
I think it's something where you have to put that back out and you have to change. I'm using this opportunity to reset. Like you said, you've regrew, you left it, it's there for me to cut my new lines, and I got to make sure my lines are good. And that's why I'm like, okay, it actually adds a little bit of extra pressure on me right now. And maybe it's just that. Maybe I just don't want to mess up the neuroplasticity that's been developed. I want to make sure that I cut in the right lines so that in a month, 2 months, when I have some issues, I go to the right place rather than the wrong place that has been cut. Does that make sense?
100%. You're not going to go down that default mode network, which is the bad line. That's the line where you're going to lose time. You want to cut the good line where you're going to be smooth and gain time. I mean, if we want to do an analogy, motocross analogy, So yeah,
but I do feel like with this treatment, though, hypothetically, so if I just did this with my buddy and I was in a bad place and then I didn't have anyone talk to me afterward or tell me, hey, listen, this is what you need to do, and I went right back to negativity, I almost feel like I could reinforce the negativity even worse.
Yes, that's a good point. You can any drug can do that really, but that's why it's so important to have the right setting, people around you, and don't do it. Just don't do it willy nilly, and because it is an abused drug. When it's gotten off the street, when it's not though, it's the abuse potential of it, is almost nil. Dave Feifel showed that in his studies out of 6,000 patients. And then the other thing is, it's all clean and I'd say the last thing on illicit ketamine is just it's nothing to. You'll see it at raves and all this kind of stuff, and like I said, it's apples and oranges, and it doesn't. And a real ketamine treatment doesn't last, but I mean, an hour or two. It stays in the system, whatever the half-life I think is like 8 or 12 hours or something like that, and then it's out of your system pretty much, and then the next day you're good. So it's
Yeah, it's
so there's and that there's other people taking it just to get rid of their problems. Like I had one NFL guy take it, or it wasn't my patient, but somebody I talked to the psychiatrist and all that, and his name's Dr. Militek, and it's on his website. And by doing a psychedelic like ketamine, he was able to get rid of his childhood traumas and things that just set him off. And because of that, he was able to play a more effective NFL game. And he's not the first person I've seen do this. So, could it help somebody on the motocross track? I think so. I think the potential is there. I think it could go both ways, but I think the potential to, there's no shortage of trauma from the kids growing up in motocross today. Your parents just yelling at you, opportunities are taken from you. You're not in normal environments, usually homeschooled, you're traveling. There's immense pressure on you from, 12 years old, 13 years old. All that's not normal, and all this to make, a superstar kid. There's going to be some traumas in there. I've been I've seen motocross. I grew up with it a long time. And I was there too. Not, it was never at that level when we were racing. Now it's a whole nother thing. But, the pressures I see put on the kids nowadays. And again, I'm not suggesting kids should do ketamine, something like that. I'm just saying that these are the things that are in motocross, and it's in more people than you think. And it's just maybe it's just a highlight that, don't be afraid to get some mental help when you need it. Because I think it could improve your motocross. It can improve your life. Like Michael Phelps, it's okay not to be okay. Just get some help, because it's going to help you down the road.
Yeah, you would if you were having some sort of a issue with your knee. You go see a doctor, you do some rehab, you get it done. No difference with your mind. One thing I did notice too is, so I'm a big believer in if you put it out in the universe, it comes back. It was so funny. I was at a coffee shop, ran into a girl. She's a coach for Tony Robbins. Yesterday, I swear to you. And I'm like,
oh my God,
did I manifest this because of that? And we started we talked for like 2 hours, and it was crazy.
Wow.
Yeah.
Yeah, I know Tony Robbins. He actually helped me with my book a bit. So, yeah, and his wife. So they're great sages. Sage and Tony are awesome people. And it's it's a little costly to get into there, but I've done it. It's it's good therapy. That's a great connection. But
how crazy is that?
How crazy is
like
that?
the day after I do a ketamine treatment, I'm at coffee and I run into them. I'm like, oh my God. And like, she's like, oh yeah. And next thing, I'm Tony Robbins' coach. I'm like, what?
No way.
Yeah. I'm like, wow, universe. It's funny. And I'm sorry, I don't want to get too deep on people, but after what I just went through with the ketamine, that's not an accident. That doesn't just happen. I feel like there's this whole other dimension. I don't want to get too far out there. It's not a Joe Rogan podcast.
Right.
But it is weird how that happens, and you can draw in positive or you can draw in negative, but but it takes focus. You have to actually practice, and I think this just offers you like a reset, if that makes a difference. So, and I feel like I've gotten a reset, and maybe it's not for everybody, but if you're struggling and you want to try it, make sure it's with a doctor at a clinic, and you do the steps to make sure you're going to follow through with the therapy.
Anybody here listening to this, just shoot me an email. I'm searchable. My email's on my website, jonathanedwardsnd.com. And I have time, and if I can help you and answer some questions, I'm certainly in a position I could take the time and do my best.
And you're located in Florida, but you come here to Vegas.
Yeah, I work in both Las Vegas and I work in both Florida, and I have clinics in both places.
What if somebody's in, say, Pennsylvania? Do you know people where you could direct them to?
Mm-hmm. There's about 400 ketamine clinics in the nation right now, and they're all over. But it's always good to do your homework before you go to one. and because there are differences. But yeah, they're all over, and I mean, they're pretty affordable. Just the problem is they're mostly in the big cities, so they can be a chore to get to them sometimes.
Yeah, and it's not a magic bullet. It's not
No,
something that's just going to fix you. You still have to do the work. It just offers you like a fresh reset.
yeah, there's no miracles here. Don't believe in miracles. Just believe in starting small, cleaning up small parts of your room, and doing small things, and then getting a little better each day. And I mean that's the best thing that can come out of it. So,
Awesome. Thanks, Doc. I really appreciate it.
all right, man.